Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, everybody. Welcome back. I'm Dr. Hal Stewart. This is part 2 of a 2-part series. Our guest today is Dr. Craig Harry. He's the co-founder of the Stewart Center for Biorejuvenation Dental Medicine. We co-founded this teaching center about 8 years ago and have been teaching dentists all over the world a spectacular form of dentistry called biorejuvenation dentistry. Last week, we identified really what the difference between biorejuvenation dentistry and just traditional dentistry that you would go to your general dentist to get. And just to rehash that, where biorejuvenation dentistry is founded on 4 principles: a healthy airway, a stable temporomandibular joint, the proper way the teeth, the upper and lower jaw, function against each other, and the actual form of the teeth themselves. We incorporate all 4 of those into treating our patients, and what we end up with are beautiful, long-lasting, healthy, comfortable smiles and chewing systems at a fraction of the cost of what traditional dentistry would do it with porcelain and crowns and bridges. We do it with additive techniques where we take a synthetic type of a enamel material called composite and restructure the mouth with the composite by adding back what the patient has lost rather than grinding more tooth structure down. Dr. Harry, Craig Harry, welcome. Craig's a great friend of mine and as well as teaching colleague, so it's good to have you back again this week.
Hal, thank you. It's great to be back. I'm looking forward to following up some of the discussions we had last week.
Yeah, so for our audience that didn't listen last week, you can go back on our podcast site or on our YouTube channel, and the YouTube channel would be better because you can actually see the cases and update. But today we want to jump right into some of the cases that Dr. Harry has completed over the years. What do you got for us today, Craig? What's our first case?
Well, I'm excited to show this because I think it shows the power of how we can help a person who was in serious need. And as a little bit of background, this particular individual was a Korean and was adopted by a family here in the United States and ended up living in my city. And I got a frantic call from a dentist that she had gone to for second or third opinion. And she had been to a dentist that coerced her into crowning all of her back teeth, basically sort of made her proceed on with some threats of you're going to lose your teeth, et cetera, et cetera. Long-term story. It ended up in litigation, and it was a very complicated, very long case. Took probably 8 years to complete just because she moved away and then came back and had to travel back and forth. But in the end, probably one of the most satisfying things that I've ever done. And in all honesty, I gained a great friend, and we communicate via text and emails just about life now. And I know that I'm grateful to have met her and have had an opportunity to help her. And I know that she is a whole person again.
What were her symptoms, Craig?
That's what I was just going to say. When I met her, she could not get her teeth together all the way. They had not factored in the entire muscular system and the way the jaws fit. And so when she bit down, she had a big gap in front and she could not get her teeth together. So she had no comfortable, normal bite. And she had new crowns on all of her back teeth that were absolutely snow white, and they were very flat. So it goes against everything that the human body is. And so I knew that we were going to have to go through a very long process. And unfortunately, when you try to recover a situation like this, once a crown is done, you have to go in and take that crown off and redo it and hopefully build it back better, giving more form to the tooth. But she was in significant pain. I did a 30-minute video with her, talking to her about the problems that she had and the symptoms that she felt. And she essentially cried for 30 minutes. It was very powerful. I had a group of students in the room listening to her story, and it was incredibly compelling, the power that we have as dentists to adversely affect a person's life. Because anything that we do where we remove or cut is an irreversible process. And you can only get that back if you have the skills and talents, that you understand the system and you understand what health looks like, so that you can work backwards. Because that's essentially what you have to do in a situation like this, is work backwards.
Yeah, you made a great point, Craig. One of the things that Craig and I teach the doctors that go through our teaching center is that the mouth is probably the most intimate part of the body, and it needs to be treated with great respect. And we really need to be careful when we're working inside the mouth to make the patient understand that we're doing the very best for them. And our first, like any doctor, is first do no harm. And we feel very strongly about cutting teeth down and putting crowns on them. Sometimes we have to do that.
And we do, yeah.
And we do. But the majority of the cases that we do now, and I can speak for Craig on this, are 90% of them are no crowns. Many of these cases, maybe this one, Craig, we don't even have to use to anesthetize the mouth to restore them. A lot of these cases, because we're not grinding, we're just adding back. Tell us about this case, Craig.
And if we move on to this patient here, that was a great segue, because I would consider this to be, if there's such a thing as a garden variety case, or a just perfectly made for TV biorejuvenation case. This woman approaching 50, her main concern was that she lost 2 lower left molars and an upper right molar. So some of her key back teeth. A healthy person, very little decay. And she obviously didn't lose those teeth because, she got big cavities in them or what have you. She actually cracked them and fractured them. And she presented to me with the lower 2 missing on the left, and the upper right one had been replaced with a bridge. Well, if she probably had bite problems, and that's why she was clinching, and that's why the teeth broke. And the bridge in the upper right, the dentist that did it did not understand the way her bite was, and did not understand when a person has clenching issues like that, they probably got something wrong with the way their teeth fit in relation to their jaws. And so the bridge was not fitting properly and was in the way, and it affected her bite. She was starting to get symptomatic. But basically, to treat this case with biorejuvenation, we go back to our 4 keys or principles. And what the most important thing we do after we understand how their airway health is to look at their jaw joints and to stabilize those through a process that we do. And then we know that we've set the table to go in and rebuild their mouth. And this case was done all with additive coronoplasty. We did end up doing some implants on the lower left, but you can see the remarkable difference in both. In this one, it's a total face in terms of the height and width, the vertical height of the smile, the relaxation of the cheeks and the eyes, and just the much more alive, and I would call it healthy and robust look to a person who's probably 2 years older in one picture than they are in another. But lots of fun to do.
Yeah, these are typical cases we see. And when we say it's a garden variety, that's a testament to the fact that there's so many people out there that don't realize that something so non-invasive can make such a huge difference. You can tell the after picture, she was more relaxed. Of course, her smile looks better. She looks younger. We see this time and time again. Let's pull up another case, Craig, and let you tell us about this gentleman.
Yeah, and this is another one that I was really just pleased to have the opportunity, because as you know, how we really get to know these human beings on another level when we're doing this type of intimate dentistry, because it requires a lot of time in the dental office, and we have to put a lot of time in when we're there in the clinic, but also outside of the clinic on weekends or evenings or whatever, because it takes a lot of time to diagnose and correctly plan for these cases. But this gentleman's ex-military, was hurt in the military and had a neck injury, and that's why his head is canted or tilted. But his chief complaint, like so many, was that he was putting so much pressure down on his teeth that he actually cracked an implant, the actual implant body that was up in the bone, in two. He had lost another tooth on the upper left, and an oral surgeon sent him to me because he was, I think he was trying to cover himself a little bit, because, my Lord, the implant breaking, there's the patient's going to point some finger somewhere. How does this happen? But it was just the load he was putting down. So when we see people like that, they're perfect patients to deprogram their habits and their chewing system so that we can get them to relax their muscles and gain a ability to line up their bite with their jaws and such. And that's what we did in this case here, was go through a process to get the jaws relaxed and to stabilize the jaw joints. And then we can fit in and sort of restore or fill in the teeth to match that position so that the dental skeleton is all aligned. And he's another guy then that, when I told him how much it was going to cost to do this, he hesitated for a minute, and he called me on the phone a couple days later and said, I'm in, and he's never regretted it. And I will point out one thing on cost. When we do these cases with more conservative materials and we don't have to go through the whole crowning process, the cost is much, much less expensive. So not only is it more conservative, but it costs less, which is really a win-win for patients. And I think it makes it a lot more achievable and a lot more doable for a larger percentage of the population.
Yeah, that's a great point on cost, because we see patients all the time that have lost 2 or 3 or 4 teeth, and they want to get them replaced. By the time they have dental implants done, by the time they have the crowns done, they spend more money on replacing those 2 or 3 teeth than they would have if they would have had their entire system treated like we treat it with biorejuvenation dentistry before they ever lost the teeth. And so it really, sometimes the price tag might look high, but in the end, it's actually just a fraction of the cost of what traditional dentistry costs. Craig, tell our audience just briefly, because I know over the years when I will talk to patients and say the first thing we do is stabilize your jaw, they think that, okay, how does that happen? Is there some kind of surgery involved, or that sounds like a painful process? What do we do to create that harmony and stabilize the jaw and the muscles before we actually restore the bite?
Okay, I think, Hal, it's the most important part of the total treatment that we provide for these people. And I think the easiest way to think about it is that the dental skeleton consists essentially of the jaw joints, where the lower jaw connects with the skull, and the teeth. And in most human beings, they're not completely aligned, all 3 of them. When they're not aligned in some people, it creates a problem and they become symptomatic. It's a fairly small percentage of the population, probably overall, because our bodies are very adaptive and they can live with things that are asymmetrical. But if a person has an issue and they can no longer adapt, all of a sudden they become symptomatic or they start having problems. So our first order of treatment after we diagnose and treatment plan the case, in most instances, is to create a stabilization of the lower jaw to the skull. I mentioned last week that the lower jaw really is kind of a moving target, that it just kind of hangs there. And if we build the teeth indiscriminately and we don't take into account the braced position of the lower jaw against the skull, there's not a chance in 1 in 100 that we're going to be right. If we want to have our dentistry last, and if we want to get the patient to the point where they don't have symptoms anymore, we can relieve pain and discomfort that comes from a unbalanced chewing system in the 90th percentile. We can't work on an unstable mouth and do this kind of dentistry. So the first thing that we do through the use of a dental orthotic that fits over the upper teeth is stabilize things. And it really is a physical therapy process that might take 12 weeks, give or take. But it's a critical component. I know Hal and I will never be willing to compromise what we do, and will not do this type of dentistry on somebody who, for whatever reason, is not comfortable going through the physical therapy utilizing the orthotic.
So the cause for if somebody, anybody that drives a car, if they took their car in because it was wobbling when they went over 30 miles an hour, and the mechanic said, "Oh, look at your tires. Your tires are completely worn. They're all uneven. The outside tread is worn on this tire. The inside tread's worn on this tire, and it's because your wheels are not aligned properly." There's nobody out there that would say, "Well, just give me some new tires, put them on the same wheels, and I'll just go with that." They would hold up for a while. It makes perfect sense to line the wheels up, realign the wheels, then put the new tires on. Dentistry in general just does the opposite. They don't reline the wheels. They just put new tires, new crowns. If your teeth are worn down, that's because your joint and your teeth aren't in alignment. So that's the first thing that we do. And this centering orthotic that Dr. Harry talks about is it sounds very simple, and really it is, in the fact that it's just a clear mouthpiece the patient wears, and they can talk and sing and eat and dance and live their life in it, and it creates harmony and centers the joint. Then we go on to the teeth. Craig, show us, I think we got time for one more case. Let's see what you got.
I just love this woman. She came to me on a self-referral, essentially, and her story is more important than the dentistry. Her husband was in a tragic motorcycle accident about 25 years ago when he was probably in his 30s, and he's paralyzed from the neck down. She has helped him and served him. She has to do literally everything for him. He can't move his arms or his legs or anything, and she is his primary caregiver. Economically, it's difficult, I know, for them. She drives a school bus during the school year, in the mornings and the evenings, and she just over time started to develop a lot of pain and discomfort, and she's in her jaw system, I should say. And she's pretty holistic in nature, and she had a lot of old silver fillings in her mouth, and those were all removed. And then we knew we had to balance her bite because we were never going to get her comfortable and align her jaws. And so, again, this is one of those cases that is pretty straightforward. It's a jaw issue. And one thing I wanted to point out is when we do biorejuvenation dentistry, we're really doing somewhat of a dental holistic procedure, but we're also able to mitigate dental jaw muscle joint pain. And so in a way, we are treating TMJ or TMD, if one has heard of that before. And that's really this case here. And a lot of the cases that we do, there is pain there because the chewing system is breaking down. So the photo on the right was taken by her daughter, who is a professional photographer. And you can see how beautiful this woman is, and what a real rewarding case it is to be able to give her back her life and something that she doesn't have to worry about now. And then she can, keep moving on, doing the things that she knows she has to do day to day. And she's just a real amazing person who I can't imagine the life that she lives and how she does it with, basically dignity and respect for her husband.
That is just incredible. I mean, the difference, if you don't even know the story, just looking at the difference, once you know the story behind it, it's even more powerful. And Craig, we're blessed that we get to do this every single day. And I, for one, am envious of, or I feel sorry for other people that don't get to experience what we get to experience when we complete cases like this. So
Yeah, how, like we've said, biorejuvenation dentistry is probably more for us than it is for our patients, because the satisfaction and the rewards that we receive, and certainly not monetary, just the friendships we make, and how it makes us feel,
Yeah.
is way bigger than anything you could do with traditional dentistry. That's for sure.
Yeah, I agree 100%. So as always, like we did last week, Craig, you've picked a song for us to play. Why don't we play that song and then let Craig comment about it?
I'm 15 for a moment, caught in between 10 and 20, and I'm just dreaming, counting the ways to where you are. I'm 22 for a moment, and she feels better than ever, and we're on fire, making our way back from Mars. 15, there's still time for you, time to buy and time to lose. 15, there's never a wish better than this, when you only got 100 years to live.
Haven't heard that song in a while. That's a fantastic song.
Well, I mean, it really speaks to us, Hal, when you realize, and it certainly as you get a little older, you got 100 years, and you've got to live the life that you want. And in all parts of our life, both our personal life and our professional life and our spiritual life, I can't imagine going to work every day and not absolutely loving what you do. I told my children that you've got to go to work for 40 years, 50 weeks a year, 8 hours a day. And if every day you roll out of bed, you just say, ugh, I can't even stand it, I don't want to go. It's just going to be a really sad life. And it's, life is not perfect for anybody by any stretch, but that song is such a great reflection on life passing by and how quickly it goes. And you got to live your dreams, and you got to live, the life that you want to live. And that goes for the biorejuvenation dentistry. I mean, if we can provide this type of care for our patients and have the satisfaction professionally, it makes dentistry, really a hobby for us. And that's what I think. I know both you and I feel like dentistry is certainly our chosen profession, and one that's brought a lot of happiness and professional satisfaction to us.
And creating harmony in the mouth is it just goes along with harmony in our life. We can't be healthy if there's not some level of harmony there, of things flowing and the ebb and flow. Like you said, Craig, nobody's life is perfect, but I've never met a 100-year-old that didn't have a balance in their life. They don't live that long without a balance. And that's why I love this podcast and the name of it, because our bodies need to be in balance. Our lives need to be in balance. And I am honored and thankful every day, Craig, that you are my friend, that you are my colleague, and that we get to share special times like these together, and also when we teach. So thank you again for being on the podcast, buddy. I appreciate it.
Yeah, Hal, thank you so much for inviting me. It's been my pleasure. And, whoever watches this, I hope in some way it helps them. I really do.
And someone's going to need to see this, and they're going to see it, and it's going to lead them to either you or me or one of our residents who's completed our teaching. So again, Craig, thank you. This has been Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. We will see you next week. Live good, live clean, and be happy and harmonious.